realize how much grief there is around us, and so much more valued your assistance is. Now I am speaking about palliative care at this conference because I think it is a topic belonging to the topic of this conference, and people who faced a palliative situation with their children are at war every day of their life. All of the external factors apart, and the large-scale invasion apart, they have been in a very hard physical and mental condition right upon learning about their children's diagnosis, and they still have to get this will and strength to go on living. I'm Vira Zalivadna. I cooperate with the Palliative Fund. I'm a psychologist working with parents. So I will be speaking more about families with children in palliative care, or children with diagnosed oncological diseases. And I'm also a grief therapy trainer. And I think that grief therapy is an extremely important topic for today. Unfortunately, we don't have a tradition in our culture to discuss this. But when it comes to psychological interventions, then you might know that if there is a topic that worries us, but we can't discuss it, it does not contribute to either mental, psychological, or even physical health of an individual or a nation at large. So I think people should start discussing these topics today. Here's the outline of my presentation today. What's palliative care? I got acquainted with this topic without knowing anything about it. I didn't know that there is this huge need in the country. I joined the fund to work as a psychologist to supervise groups of parents who lost their children, and then I was offered a chance to be part of this palliative care community, and I understood that it is a topic requiring more study. Parents grieve in palliative care. If you work in the area of loss and death and grief, you will know that there are certain specifics here. Stages in providing psychological support and specifics of work when it comes to palliative care, and impact of war on patients with a palliative status. A bit of theory. Patients with palliative status. Patients with palliative status are those belonging to various age groups, but who are sick with a disease that cannot be cured, incurable or terminal disease. So this here where I work in the Palliative Fund that collaborates with the families of oncological patients. But in our case, palliative care is offered to children with terminal cancer. So for you to appreciate the situation, sometimes after the radiotherapy, mothers would be let know that with this diagnosis, a child can only survive for another year. Can you imagine the mental state of such mother? I respect the idea that we should not be grading the extent of grief and loss, but when you lose a child, this feeling of injustice, unfairness is overwhelming. Sometimes it can just totally grip a person. Parents might sometimes be unable to speak about it, and they may lose the entire family. I know such a family when they got this final diagnosis, and they are now in Kiev, but their head of the family, the father, wasn't by their side, and the mother asked me whether she should inform her husband, and it's not up to me to say. There was another family where both father and mother lived together, and once they learned about this diagnosis, they felt guilt, and they actually channeled this guilt against each other, and that was a true crisis within the family. They were trying to cope with their upcoming loss, with those emotions, and they held grudge against their spouse. They say, you didn't see it, you didn't follow your child on their trajectory to death. I visited that girl in the hospital. She was 18 and she was dying in front of our eyes. And when you observe this, you think perhaps it would be easier for you to exhale and let go. But every time when you exhale, you understand that this child is still there, and you want the child not to exhale for their last time. Mothers sit by in hospitals in hospital wards, but fathers were not by the child's side. So the father lived in Lviv, and the body was later returned to Lviv, and at a certain moment the father told his wife that she was guilty, that she failed to save the child, the daughter. So we have to work with the bereaved parents to stop them from this aggression. So that's why I told you that palliative care that I work with is different from palliative care in cases when the illness is not terminal. So what is proper just in palliative care are the very terminal stages of the disease when nothing can be changed. You understand that it has specificity. We don't have palliative patients, we have palliative care, and that is a type of medical care, a whole set of measures that are carried out by a multidisciplinary team to support the quality of life of a sick child. And in order to relieve some suffering, we do that for the child. Our main task would be prophylaxis, just treating chronic pain syndrome, and it also can be relevant to the military when it comes to the pain syndrome. Then it is also care and psychological and spiritual support of both the sick person and their family. When people encounter the terminal diagnosis, we sometimes encourage people to fight till the very end, but our life is not very easy, and oftentimes when I start talking to the family members, I find out that this point where they learn about their diagnosis is not the greatest tragedy of their life. Now we are supporting a family. When I first got acquainted with them, the mother said that 3 years earlier she lost her husband, and it was a very friendly family. The spouses knew each other since they were 16. They had 2 children, but then she lost her husband to an accident, and she said that I was still grieving this loss. And then the large-scale invasion occurred, and that exacerbates any trauma that we used to have before. You will remember how it all started when we were counting days, then weeks, then months, and then she learned about her daughter's terminal disease or lethal disease. There's a whole sequence of events that are equally traumatic, and you don't have the time and perhaps the power to cope with all of those events. But that the support can be very challenging. I started speaking about it because psychological and spiritual support is extremely important. People focus on saving their nearest and dearest, saying that it's all I've got, and if I fail, then it would be the end of my life. They